Good afternoon. I hope you enjoyed the lunch, even though there is really just 1 hour break. We are going to start another very important session, Smart Health, the value for everyone. This is a talk about another talk on strategy, how to achieve smart health city. But the approaches and the ways to achieve smart health city probably are a little different between developed countries and developing countries. So in this session, we are more focusing on ASEAN, how to achieve smart health city in the region. That will be very much an important step for the ASEAN healthcare strategy. So for this panel, for this session, we have 5 great panelists. So I will introduce 5 panelists. Right to me, Dr. Naguno from Naver Healthcare Lab. Please join me, welcome him. And right to him, Dr. Tan Yang Mao, Vice Minister of Health from Cambodia. And right to him, Paiban Kyopas, the Vice Minister of Health, Lao PDR. Right to him, Karina Kuchma Wardani, Digital Transformation Officer, Minister of Health, Indonesia. Right to her, Yu Song Hwang, Medical Director of Seagen Medical Foundation, Korea. So, the beginning this session, I would like to give a little small talk on Smart Health City, the concept and vision of Smart Health City. Then going back to our panelists for discussion, and also want to have interaction with you on the floor. So this is a session, not just the lecture style session. This is a really interactive session. Firstly, I would like to giving my brief talk on Smart Health City first. Please show the slide. So my title is Concept and Vision of Smart Health City, but this is a little general, the concept and vision. So it's not about the ASEAN countries, but we need to focus on ASEAN countries when we think about how to achieve a smart health city in the region. Firstly, the smart health city strategy for healthcare innovation can provide quality services accessible to all populations for vulnerable communities at an affordable cost to advance the sustainable development goals and universal health coverage. That means our goal is sustainable development goals and universal health coverage, but we should provide quality service at an affordable cost. So there are really a lot of challenges implicated in Smart Health City strategy. Particularly today, this strategy aims to support ASEAN member states to improve healthcare systems in response to growing healthcare demand and rising healthcare costs through technological measures to build a smart health city centered on networks of individuals, healthcare providers, and related institutions. But this strategy or idea is not out of the blue. This strategy should be well aligned with the existing statement of policy or strategy in ASEAN. So one of such a strategy, particularly for the ASEAN-Korean cooperation strategy, is the ASEAN ROK joint statement that actually stated that enhancing access to the quality of healthcare service toward attaining universal health coverage and strengthening health security measures by increasing the utilization of high-caliber ICT system, artificial intelligence, and big data to reduce medical costs, prevent counterfeit medicines, prevent and respond to emerging infectious disease. So this is a currently existing joint statement between ASEAN and ROK. Even the ROK President Yoon said that he actually pushed the Korean ASEAN Solidarity Initiative in earnest by announcing plans to strengthen cooperation in the cyber and maritime security fields and cooperation projects in the digital innovation field. So this is just one piece of currently existing strategy. There are also other strategies in ASEAN in line with smart health city strategy we are talking about today. But we should understand what is the current constraint healthcare service in ASEAN. I think all over the world, including ROK and the European countries, the Americans, Japan, China, all we are suffering from lack of shortage of healthcare service. But particularly ASEAN, they are suffering more from the constraints of healthcare service. So that is the one piece of fact we should consider. And there are also double burden. They also have increasing disease, chronic disease, infectious disease, but also the increasing cost for the medical service. So they also have such a burden. But the ASEAN, the countries, it's relatively younger than the other parts of the world in terms of the population age. But the ASEAN also will experience such a the population change. There could be really elderly population growing over time. And they already experience a prevalent chronic disease, and such a disease is increasing now. So that is also a burden in ASEAN. And the spending of the cost for the medical service is also increasing in ASEAN. And of course, the ASEAN also suffered COVID-19, even though compared to other regions, ASEAN did well in response to COVID-19, but we will have another the pandemic coming soon. So there will be another strategy to respond to such a disease. So considering all of this, we should have new strategy. The issue is what would be the new strategy to respond to such a risk coming soon? The population change and pandemic and the increasing cost of medical service, all is challenging now experienced in ASEAN. So we need to have the new strategy, but what would be the new strategy? That's the question. But I think that could be people-centered medicine, community-based medical service, and distributed medical cooperation system. That is actually changing from disease-focused medicine before, and hospital-centered medical service before, hierarchical medical delivery system before. So it's a new concept and a new vision for the future. So considering all this, we can say that would be human-centered smart health city. That is not just a smart city, focusing on convenience. It is on health and safety in the center of the society. That is human-centered smart health city, we need to renovate home. We should build new community, and the medical service, healthcare service should be provided to the people in the community. That is the way opposite to the current system. Currently, the patients or people in the community go to the hospital to get healthcare, but in the future, probably the healthcare service should go to the community or the people living in the community. So that is, I think that is a huge change of the direction in the future. We need to utilize health monitoring, which is available now, and probably home also can be changed with some digital technology. That is also currently available. And we need to focus on the community healthcare service, particularly community primary healthcare service, because many of the people and the patients should be provided by the healthcare service in town, in community at home, not just in the hospital. So that is a new way of healthcare service. Summarizing this one, we can say in the town there could be primary healthcare service utilizing information from home and from individuals by monitoring, and then somehow the doctors or health professional can provide healthcare service in town, but some disease in severity can go to the secondary hospital or tertiary hospital, but there should be a connection between the person in the community to the higher level hospital. So that is kind of a smart way to provide healthcare service. And the center is a primary healthcare in the community. So the home or the people living home have data connected from the home and the healthcare service, even some life care platform service. So that is actually people-centered medical healthcare service, or these patient-centered healthcare service, not disease-centered healthcare service. That is a smart city based on platform. But the problem is, you may think that this is a really high-tech. How can we build or equip such a system in ASEAN? So that is actually the question today. How can we realize such a system? So that is actually one of the questions I want to give you and want to get feedback from you. So finally, what is the goal of this argument about the smart health city is a self-reliant smart health city that actually from the frequent interaction between people and using social capital much. It should be preventive medical service, and there should be community care for all inhabitants in the town, and using high technology. So that is my the brief talk, brief introduction of the smart city. Because the term of the smart city kind of they remind you about high technology use. And you may have a question, how developing countries with the somehow a little poor infrastructure supporting such a digital technology can achieve the smarter city. So that is one big question to you. So I would like to give this question for you in the first round. And the beginning with Dr. Na. He's a founder of the healthcare service, the part in neighbor. So would you please introduce yourself a little more, then respond to my question first.
Thank you, Professor Hong. It's a great honor to participate on this World Health City Forum today in beautiful city of Incheon, Songdo. To introduce myself and my company, Naver is a search engine company like Google in South Korea. And we actually run a messenger services in some parts of the Southeast Asia, ASEAN countries, mainly Thailand and Indonesia, called the Line Messenger. So we run messenger service in Southeast Asia as well. In going back to the ASEAN community care, connected care, I think we're living in a very different world since 2007, when mobile communication exploded in the world, including ASEAN countries. So the problem we had about the primary care and the community care, it all needed a connection of some healthcare professionals reaching the population on the ground. However, now everyone, including myself, has a smartwatch, smartphones, which is a connecting device, a handheld device to connect not only all the data sets, but including the healthcare data sets can be monitored by different parties. I know there are many great startups in Indonesia, in Laos and Cambodia, which service population in smart digital healthcare. But I think we are in a very beginning phase where all these applications on smartphones and digital solutions offered by the government and the hospitals are very complex. Everybody's doing their own. But I think at the end of the day, some solutions will survive, mainly like Google, or maybe Naver in Korea, Line in Southeast Asia. And then within this power of a platform, aided by the artificial intelligence technology, great the reduction in the human resources, which is a very scarce, especially in Southeast Asia, can be probably another solution we can look for. Lastly, I think the center of healthcare in the future, I believe personally, is at homes, not hospitals anymore. So how to connect your homes would be, do we need primary care services like today? I've seen some other continents like Africa, Kenya, where not the physician-led programs, but they're having a first and second tier programs led by dispensaries, usually pharmacists and nurses. So I think various options can be available with the current availability of the high-tech solutions. Thank you very much.
Okay, thank you very much. So I understand the Naver is one of the really great IT companies in Korea, and he is in charge of the healthcare. So from the technical point of view, do you think we can do something to make a smarter city in ASEAN?
The answer is, of course, yes, very yes. But I think it's a partnership between the government, which controls the policies of each countries. Number two, I think, is the resources. For the resources side, I think there are other the sources of money, including the Asia Development Bank, World Bank, so some of the solutions. Even the Korean government offers an external collaboration fund called the EDCF. So I think with these funds and the government initiative, I think the smart city projects can be customized by the different nature and different the culture, the stance of each countries. And I think I suggest we start from small, not to try to do a nationwide scale of a project, maybe a small province, small city project, and these experiences can be extended to the nationwide projects, then extended to the ASEAN project. I think that's a more logical stepwise approach.
Thank you very much for sharing your view and actually the way of approach. And next, I would like to give my microphone to Dr. Mao. He graduated medical school and a medical doctor. Now currently Vice Minister of Health, Cambodia. Would you please respond to? Would you please introduce yourself more and respond to these questions?
Thank you for all. Thank you, Chair. Essentially, distinguished guests, ladies and gentlemen. It's our pleasure to be here. We are on behalf of Cambodia delegates, Ministry of Health and Ministry of Environment. We'd like to express our great thanks to the organizer for the invitation and also the opportunity for us to join and share our view, especially on this context of health city or smart city. I just would like to start with a few points in terms of the fact that how could we strengthen or build on our community in terms of health or smart city, something like that. With the start from the point that first, I think we should look at reviewing our policy, our system, especially in the PHC primary healthcare, to look at how could it be of some reflection to the new concept, to the idea of smart city or healthy city, especially as far as community and PHC concerned, because we should look at community and health center or something like that, PHC, because in our country, PHC meaning from health center, so health center. So we do look at that, and then we could as the issue of each setting is vary from place to place. And as the concept of health city is kind of multi-sectoral, multi-dimensional, so we need to try to understand, first, within our policy or system, the need of our population, our community, in terms of health and other related needs. Second, we need to try to understand the issue related to that, and then we should come up with some kind of more comprehensive approach or strategy to deal with, to address to the need, as well as address to the issue. And like he said, I fully agree that we should start with some kind of practical plan or action project to deal with, and starting with some pilot or whatever. I said I fully agree that we should start with that and to see how it works. Because as I mentioned earlier on, that issue is different from one setting to another, as far as health issue, health concern, etc., including a broader or bigger health, like you mentioned about the pandemic, because we should to work on the so-called PPR, pandemic prevention and preparedness and response, in terms of what should be the case if there's other epidemic happening in the future. Now with COVID and some other related, so something like that. So I think, and yes, I said we should do some action. You mentioned, Mr. Chair, about doing some action. So apart from having a kind of comprehensive plan or strategy, we should have some practical action project to start. Of course, work within our system. As I mentioned, we should reflect in our health system, healthcare system of each setting, country or district, whatever. So, and then we'll see how it works. And of course, we're not forgetting about this digital health, digitalization that we should link with the modern technology, green environment approach, something, because now health is not just only health, but also medical service, but other related sector, field, nutrition, road safety, health care behavior, etc., so that we could deal with. This should be started from community, and then of course everything need to be geared toward UHC, you have covered, whereby I should not forget the word that we should support the idea of leaving no one behind in terms of healthcare service, as well as other basic needs and service in the community within the smart health city or whatever. Thank you very much.
Thank you very much for sharing your viewpoint. So I also understand the smart health city is not just the out of the blue. It's not something fallen from the sky. You should utilize current healthcare service system in the country, right? So you said the public health center, right? And you said the multi-dimensional, multi-sectoral approach to have a practical the approach to achieve that. So thank you very much. And then I will go to Paivan Kyopas. He's also a medical doctor and the vice minister of the Lao PDR. So please introduce yourself a little more than coming back to this issue.
Thank you very much, Chair. So, thank you for your question, because the first you asked about the strategy for healthcare or healthy city. So, for my viewpoint, I would like to report to you 2 points. The first, healthy city in the past in Lao PDR. And the second, I will talk about strategy plan. So for the past, for the healthy city, so we start from 1998. And we have a project for the healthy city in the past. For example, smoking free, waste management, water sanitation and hygiene, transportation safety, clean hospital, something like that. But however, we don't have indicator to evaluate about what did we do and what did we did success in the past. So I think that's very important to evaluate in the future. So for the strategic plan, I just want to share because in my viewpoint of view, I think a healthy city must be appropriate balance between work and leisure. So, I mean, we will talk about quality of life should be included. For example, healthcare. So, I am from Ministry of Health, so I am going to focus about healthcare. So for the healthcare, I think easy access to quality healthcare on citizens. For example, in the past during the COVID-19 pandemic, so we have many foreigners or many citizens work in Laos. So we have to keep the quality and equity for the people who live in Laos. And this including like expand the work or healthcare facility, training more healthcare workers, and making essential medicine and vaccines more affordable. So this is very important. During COVID-19 pandemic, we can very easy to access vaccine COVID-19. Not only Lao people, but all citizens who live in Laos. And the other, so I think good quality air, water supply, restrict on available of tobacco and alcohol. But the other important is like information, because now in Vientiane capital we try to do like a DSIS2, like a district health information. So not only Vientiane capital and also on the province in Laos. And the other, I think, rapid ambulance and also like a digital health. So very important in the future. For example, during COVID-19 pandemic, we try to contact with the people or patients by use digital health. That's the first point. But the other point, I think, education. Education should be good quality school, college, and university. So this is important that give the young people the skill to face and rapidly change the world or the society, something like that. And the third, I think, environment. So environment is really important too. How to protect how to reduce like air pollution or noisy, something like that. And the next, transportation. Transportation is really important too. And again, I think technology. Technology, I think investing the technology improve the life of citizens and business. So this is including developing e-government service and expanding internet access and promoting innovation in the sector. And the next, legal services. And the last, I think, social, I think, is really important. Many stakeholders or many another should be do together, right?
Okay, thank you very much for sharing your really view about the health city, not just about healthcare or medical service, but also water, air, transportation, many things to make a healthy city, right? So that is a really important point when you think about the health city. So thank you very much. And next, I will go to Karina. So would you also please to introduce yourself a little more, then coming back to this issue?
Well, I'm going to say that Indonesia has learned 25 years of lessons learned of forming a strategy of healthy cities. We started in 1998, started with 6 cities from middle-sized cities, capital city of the province, and also small cities. And then we formed a regulatory framework with a joint decree between the Ministry of Health and the Ministry of Home Affairs, because all the cities and regencies is under coordination of Ministry of Home Affairs in 2005. And then we roll out and put some indicators. Indicators also one of our strategy, how we know how far we implement our healthy cities guidelines. That decree is about our guideline towards healthy cities. And then from then we go to the national plan. And until this year, so we are planning to issue or declare about a presidential decree. All of the lessons learned from 1998, 2005, until now, 2023, we want the better regulatory framework that can become the umbrella of a better strategy to implement the guidelines of how we form healthy cities in Indonesia.
Thank you for sharing the Indonesian, the way of the approach. It's a kind of you can have some framework,
Yes.
the roadmap, right?
Yeah, right. Yeah.
Yeah.
We also have that roadmaps in this national plan.
Right.
Okay.
I hope you explain a little more about the roadmap itself.
Sure. Okay. So the roadmaps, we have seven indicators. Where we want, the first is the people first, people-centered. We want a self-reliant community first, and then how we make a better housing. How about, and the next is about the settlement, and number 4 is about how we make a healthy wet market. We know there's a wet market and sometimes it's not really healthy, but we want to design a healthy wet market. And then so on, the transportation, tourism, so all sectors must implement these health city indicators in the roadmap.
Okay. So that is actually the good roadmap to me. In the roadmap, do you have any the concrete plan to achieve the improvement to healthcare service in that?
Yes. Improvement in the healthcare services. So after those guidelines, in parallel we have this smart city initiative. In parallel we have this health city initiative. When we make it integrate it together, and then through our transformation in our healthcare services, we want to integrate it. So it's like as easy as we have personal national healthcare applications that can monitor like air pollution, air condition pollution. It's also part of how we make our health cities, how we control which part of the city that we can do healthy living, or maybe running in the morning with a place that no pollution at all. It's the integration is like that for the healthcare and also the health city and also the smart city plan.
Okay, thank you sharing for your good roadmap and framework for the health city. And I will go to Dr. Huang. Would you please share introduce yourself a little more and then the comment on this.
예, 먼저 사과드릴 것은 제가 영어를 말하지 못해서 일단 한국어로 말씀을 드리는 거 양해 부탁드리고요. 여기 통역 서비스가 제공은 되는데 지금
Number 2 is an English channel, so you can hear.
예. 저는 그 한국의 CGN 의료재단에 있는 의사입니다. CGN 의료재단은
여기가 없어.
예, CGN 의료재단은 그 질병 검사 전문 기관이고 특별히 그 검체 검사를 통한 그 검사 서비스를 제공하고 있고요. 최근에 코비드-19 팬데믹을 거치는 동안에 많은 나라도와 마찬가지로 대한민국에서도 굉장히 많은 국민의 수보다 더 많은 코비드-19 바이러스 PCR 검사가 실시가 되었는데 저희 재단에서 가장 많은 검사를 했던 그런 기관이어서 주로 그런 분야에 대해서 관심을 갖고 있고요. 이런 그 PCR 검사의 신속한 서비스로 인해서 감염자를 좀 더 빨리 찾아내고 그 감염자로부터 파생하는 2차 감염을 좀 방역하는 예방하는데 많은 기여를 했다고 저희는 그 자평을 하고 있습니다. 오늘 말씀하신 그 주제는 저도 평소에 굉장히 많이 관심을 갖고 있었던 주제고요. 사실 한 20여 년 전에 저희가 제안했던 것 중에 하나는 스마트 아파트먼트 시스템, 그래서 아파트먼트를 건설하는 회사에게 이 아파트 단위에서 각 가구 안에 간단한 헬스케어 익제미네이션을 할 수 있는 혈압이라든지 또 소변 검사라든지 그런 것을 아주 액세스하기 쉽게 하고 그 데이터는 그 중앙화해서 해석을 하고 필요한 경우에 그 거주자를 병원으로 부른다든지 액션할 수 있는 지침을 제공한다든지 그런 서비스를 제안한 적이 있었는데 지금은 훨씬 기술이 발달돼서 여러 연자께서 말씀하셨다시피 지금 어떤 지역 내에 이런 헬스케어와 관련된 파라미터들의 측정과 모니터가 아주 쉽게 될 수가 있었습니다. 코비드-19 같은 경우에도 지금 실내 공기를 포집해서 주기적으로 PCR을 해서 디텍션 한다든지 또 하수에서 그 감염원을 디텍션 한다든지 또 실내 공기 질안에 있는 여러 가지 볼러타일 올가닉 카본이라든지 이런 유해 물질을 모니터할 수 있는 기술이 다 있기 때문에 그것을 전부 인티그레이션하면 상당히 많은 사람이 거주하고 일하는 그 공간, 도시, 타운을 아주 스마트하게 그 질병을 예방하고 또 필요한 경우에는 질병을 조기 진단하면서 사람들이 어떻게 하면 자기의 건강 증진을 위해서 액션을 할 수 있는지를 알 수 있도록 그런 기술 지원이 이제 가능하게 되어서 이것이 논의가 된다고 생각을 하는데요. 몇 가지 요약해서 말씀드리면 일단은 그런 것들이 한두 개 서비스가 제공돼서 그것도 점진적으로 제공돼서는 지역 주민들을 감격시켜서 이것이 빨리 수용할 수 있게끔 하는데 장애가 될 수도 있어서 제 생각으로는 아시아 지역일수록 좀 더 제한된 구역에서나마 이런 해당 국가의 보건의료 서비스의 제도적인 틀을 다소 깨면서도 거기에 특수한 우리나라 오늘 인천의 경제자유구역 같이 보건의료 자유구역처럼 해서 좀 그 총체적인 설계와 서비스 구현과 제공이 필요하다고 생각이 됩니다. 거기에 필요한 것들이 이제 가장 기본적인 것은 이제 그 정보 하이웨이 서비스가 되겠고요. 인터넷이라든지 그다음에 각 그 필요한 곳에 이런 제가 말씀드렸던 여러 감염원이라든지 폴루탄트의 모니터링 센서를 설치한다든지 그 정보를 수집한다든지 이런 것은 이제 결국 공공 인프라여야 되기 때문에 국가가 예산을 지원하고 그것을 운영하고 그 나오는 정보를 잘 통제하거나 뭐 이용하는 데서도 이제 그 컨트롤할 필요가 있다고 생각이 되고요. 두 번째는 이제 그것만 갖고는 어려울 것 같고 그런 기본적인 공공 인프라로부터 나온 여러 가지 데이터나 모니터라든지 이런 것들을 가지고 각 사람에게 헬스케어 피부로 와닿는 헬스케어 서비스로 인식될 수 있는 인터페이스를 소프트웨어라든지 앱이라든지 이런 것을 자유롭게 설계하고 제공하고 서비스 유료 서비스하고 이런 부분은 이제 민간 회사 베이스로 할 수밖에 없다. 그리고 그것이 나쁘지 않다 저는 생각합니다. 그렇게 해야 서비스가 정체되지 않고 계속 개선되고 경쟁하는 가운데 선택받을 수 있고 창의력이 아주 신장될 수 있고 그런 생각이어서 결국은 기본적인 것은 그 공공 인프라가 깔리기 위해서는 이제 제도적인 그 예외 조치가 있는 지역에 그렇게 돼야 되겠고 그리고 공공 인프라를 활용해서 어떻게 우리가 헬스케어 인포메이션으로 활용할 수 있는 인포메이션을 만들까는 민간 서비스의 참여를 좀 많이 활성화하고 그렇게 해야 될 것 같다는 생각이 들고요. 세 번째로 제가 강조드리고 싶은 것은 다 아시다시피 이 기존의 우리 보건의료 시스템은 보건의료 서비스의 제공과 유통이라는 관점에서 보면 상당히 비효율적입니다. 저도 의사지만 보건의료 서비스의 유통이 상당히 비효율적에서 미국에서 나온 데이터 그 보고서에 의하면 보건의료에 들어가는 비용의 3분의 1은 들이지 않아도 되는 비용을 지금 지불하고 있다. 유통 단계가 여러 곳이기 때문에 그래서 그걸 어떻게 줄일 수 있느냐 하는 것이 모든 나라의 화두입니다. 그걸 줄이는 데 있어서 이제 기존의 보건의료 서비스 제공자의 저항도 있을 거고 또 국민이 반대로 그걸 원하는 것도 있어서 잘 조율하는 게 중요한데 일단은 제 생각은 우리 홍 교수님 생각하고 좀 다를 수는 있는데 반반 기존의 서비스로 제공되는 보건의료기관 의사들에 의한 서비스 제공이 반이라면 나머지 반 정도 좀 더 디지타이제이션 되고 좀 더 통제가 가는 그런 모니터 아날리시스 프로바이드는 좀 어떤 국민들이 직접 참여할 수 있게 하는 길을 좀 열어두는 게 필요하다. 그것이 국민들도 재미있어 할 것이다 하는 것이고 과거에 이제 의료 서비스 공급을 유통을 좀 효율적으로 하는 데 있어서 중요한 개념 하나가 헬스케어 이제 커스터머를 무장시키는 겁니다. empowered customer. 그래서 뭐 정부가 아무리 좋은 어느 지역에 인프라를 깔아놔도 그거를 국민들이 잘 모르고 그래서 이용을 안 하고 그러면 아무 소용이 없어요. 그러나 우리 경험에 의하면 지금 모바일 폰 같은 것이 새로운 것이 나오면 그걸 얼리 어댑터라고 하죠. 그걸 관심 갖고 그걸 막 써보고 자기 경험을 막 적극적으로 전파하고 이런 이제 사람들이 필요합니다. 헬스케어 디지타이제이션에도 이런 부분들이 필요하기 때문에 그런 그 엠파워드 커스터머를 육성하는 것이 결국은 이런 그 디지털 헬스셋 시티를 100%, 120% 활용하고 좀 더 개선하는 데서 굉장히 중요하다. 그렇게 생각합니다. 다시 한번 한국어로 해서 죄송합니다.
Thank you very much. So actually he covers a really wide range of issues about the realization of a smarter city. To the last point, you said that I'm not with you about your opinion, but actually I'm not opposing to your opinions because every country, including ASEAN, are suffering from shortage of health professionals. In the future, there is a really increasing issue because of there is already shortage of health professionals. Indonesia really a lot of the gap between supply and demand for the health professionals. So we need to fill the gap. What would be the way to fill the gap? That would be the digital technology to fill the gap. So we need to empower people to take care of their health by the help of digital technology, but they should be coordinated, supported by the health professionals. So that is the way to provide healthcare service to the community. So I'm not opposing to your opinion. Thank you very much for sharing your really important ideas. Actually, he raised the issue about what would be the resources, what would be the ways, how to realize smarter cities. So he said that there should be some restriction-free areas, I mean regulation-free areas in some ways, so they can start some small project in such regulation-free areas, right? But that is one way. So probably the requirement would be roads or some financial issues or who would be the player. So there are a lot of issues or technical requirements. So I would like to ask to our panelists, what would be the resources if we want to realize smarter city, particularly in ASEAN? So, Dr. Na.
Yeah, it was a very enlightening discussion among the great panelists today. I think I'd like to share one example. It's not ASEAN, but in Japan, our neighboring country. During the COVID, I think Japan faced a great issue of taking care of the senior citizens, mainly by the nursing home model. I think it was very difficult to maintain because of the shortage of the healthcare professionals. I think more and more Japan is going toward the home care, the visits, the house calls, doctors visiting homes actually. I'm saying this because trying to work within the realms of primary care, secondary care, general hospital, and tertiary care, maybe it's outdated. It's not sustainable. We have to figure out something very innovative solutions. That's why we're discussing about digital solutions. So I think how to offer to our population the high quality of medical services without the current scheme of the healthcare professionals, mainly physicians and nurses. I think there should be a great change. So the model delivered in healthcare, I think maybe here in Asia, especially Korea, ASEAN countries, can institute a very new model where it will be sort of like the primary, but everyone is taking care of their own health with the aid of the digital solutions. And then by point, as Dr. Huang alluded, 1/3 of the healthcare resources is wasted or the redundant. So how to maximize and efficiently mobilize those resources probably the first step in my mind. Thank you.
Okay. Dr. Mao?
I think I should start with the fact that I think, yes, resource is resource, but we should change our mindset with the fact that resources are always problematic. Big country, small country, small community, big community. So resources are always problematic. This is one. But if we think that this is worthwhile going for it in terms of healthy community or smart city, whatever, we should bring more commitment. commitment from our leader, our management, commitment from donor, from partner. I mentioned already that it's multidimensional, cross-sector, interdisciplinary, etc., etc. So we need first about the commitment that we should all together say this is a top priority. This is good thing to do. So this is comfort is priority and commitment. Then second, I think there are some lesson learned during the last 2 days, and also I review some literature. There are some lesson learned showing that using IT utilization sometimes save a lot of cost, and also some using little cost. That some people may think it's costly, but it's not. For example, in the area of health promotion, by using this, because when come to UHC, as you may know, just a reminder that UHC have 5 components in terms of health services: diagnosis and treatment, prevention, promotion, rehabilitation, and palliative care. So in terms of IT, health prevention and promotion has been of some goodness in terms of the experience. In some countries, some projects that have been shown during the last 2 days or something, and some literature. So starting with something, what I mean is, of course, we have to have a comprehensive strategy or approach, whatever. But when it comes to action, we need to look at addressing or taking action specifically, concretely. For example, if we were to go for the UHC, which one that we could? Of course, we have this basic health facility, PAC or hospital in terms of medical care or something. But how about prevention? Because yesterday I mentioned about this reducing obesity in some places and some others, etc., using this new approach or innovative approach, whatever we call. So it's very important. So to me, I would conclude this point that yes, using digitalization, digital health protocol has been very beneficial. And of course, it's within the current technology era, including prevention or preparedness in terms of the next pandemic. That, as you said, that learning from the last few years in terms of combating COVID epidemic, so using technology, this digital, whatever connecting, and I should not forget the last point about the coordination, collaboration, partnership, and cooperation in terms of international, national, local, and inter-agency or whatever. For example, in terms of information sharing concerning this genotype of COVID. So we have to share information, etc. So this is technology. This is digital or whatever. I'm not good at digitalization, but however, this is the case that we should. So I should end that. Yes, we should not forget this that we are. It's not just new. It started quite long in some countries. Even my country, we started in '96. We call urban health pilot project. But after the support, it just closed the door, something like that. But we need to renew our idea. We need to revisit our idea on the fact that yes, how could we go ahead in terms of the current time? As I attended some situation about the smart community with solar, with whatever the system, e-car, whatever. So within this, so this should be how to integrate or interconnected with each other to provide or to give us this or to realize the concept of smart city or healthy city. I don't know how to say healthy community or something. So I thank you very much.
Okay, Dr. Paivan.
Yes, thanks again. So first of all, I agree with Dr. Mao sharing about his experience about health DCT or healthcare. Because if we talk about healthcare, so we will talk about quality of the services and so quality of the treatment. Not only for easy to access to the hospital, but we have to prepare for everything, like I mentioned before. But don't forget, if we think in the past, especially for the lesson learned from COVID-19 pandemic, so not only our country, we have to do cooperation with another partners. For example, like a foreigner, WHO, healthcare, ADB, something like that, in order to preparedness, because preparedness and response strategy is very important for another pandemic, because we don't know what will happen in the future. Maybe another pandemic will come soon. So finally, I think the basically of key future of health DCT should be consistent with high government commitment and the other intersectoral collaboration and committee participation. So that's very, very important. But however, we have to have a clearly action plan and monitoring, something like that. So thank you very much.
Thank you. Karina, please.
Yeah. So Indonesia's more than 500 regencies and cities is scattered in 5 big islands of Indonesia. And how we can make them smart. Smart in terms of if they are facing challenge, they already have the solutions. And what resources that actually we need and how we fulfill the gap. So what we learn is one is from the human resource. The human resource we get from the leaderships, from the commitment, I agree, and from the capacity of the human resource. So from the leaders and also from the communities, all have the competencies to understand, to implement what we need to be healthy cities or smart health cities. And the next is we need about infrastructure. Infrastructure from the technology infrastructure, like cloud-based and big data, because we are ranging from the east to the west, Indonesia, so we all need to be connected through the internet. When we have still several cities in Indonesia is lack of internet. That's another thing. And the other resource that we need is the right regulations. That's why I mentioned before about the regulatory framework that we need, so that regulatory can be adopted by the regencies and all the cities to be aligned with our national plan. So all have the guidelines and all follow the guidelines of becoming a healthy cities. And other resource must be financing. But financing, we can get from partnership from the private sectors and also collaboration. We all open to collaboration on how we make Indonesia's regencies and cities become healthier cities. I guess that's what we can share about the resource, how we fulfill the gap of the resource of how becoming more smart health cities.
Okay, thank you very much. Dr. Hwang, would you add to these questions?
예, 두 가지만 말씀드리고 싶은데요. 우리가 논하는 것이 의료 보건의료의 점진적인 그 디지털리제이션 이런 변화라기보다는 코비드-19의 경험을 바탕으로 해서 좀 혁신적으로 이노베이션을 하자, 패러다임 시프트를 하자 이런 주제라고 생각합니다. 보건의료 쪽에 특히 동아시아 쪽, 아시아 쪽에 많은 국가가 아직 풀리 발전되지 않은 부분이 참 많이 있어요. 그런데 저희가 오랜 동안을 보면 어떤 분야, 보건의료의 어떤 분야는 다른 분야에 비해서 이 나라에서 굉장히 빠른 발전을 하는 것들을 볼 수 있는데 그게 왜 그런 일이 일어났는가를 연구들을 했습니다. 제가 이제 또 하나 메이저라고 하고 있는 블러드 세이프티 같은 것도 마찬가지인데 어떤 나라는 왜 다른 분야는 아직도 낙후되어 있는데 블러드 세이프티만 굉장히 개선됐는가? 그 요인에는 반드시 어떤 한 사람이 있습니다. 이것을 반드시 이루고 말겠다, 개선시키겠다 하는 지식과 열정을 가진 사람이 지속적으로 노력할 때 그 분야가 개선될 수 있는 것이어서 제가 말씀드리고 싶은 것은 모든 나라에 굉장히 복잡하죠. 이 전문가들의 구조도 굉장히 복잡한데 어떤 한 분이 이 테마를 가지고 소신을 가지고 지속적으로 문제를 제기하고 사람들한테 도움을 요청한 사람이 있느냐 없느냐가 굉장히 중요하다는 제 경험에서 말씀드리는 것이고요. 또 하나는 보건의료 인프라는 깔 때 드는 비용들은 되게 그 ABD라든지 그 EDCF라든지 ODA라든지 그 자금을 투여할 수가 있어요. 공공 원조를 통해서. 그런데 더 비용이 많이 드는 것은 그 깔린 갖춰진 인프라를 계속 운영하고 유지하고 점진적으로 개선시키는 데 드는 비용이 어마어마하게 더 큰데 그런 비용들은 대개는 그런 종류의 원조 자금으로 해결이 잘 안 됩니다. 그래서 제가 아까 말씀드린 것이 기본적인 인프라는 공공 인프라 스트럭처로 건설을 하더라도 거기서 실제로 이루어지는 다양한 서비스는 민간 기업에서 제공을 해야 되겠고 그거의 전제는 저렴하게 제공해야 되는데 전제는 그런 그 여러 가지 헬스케어의 인포메이션을 디지털해서 그걸 또 빅데이터화해서 이렇게 활용할 수 있는 분야가 굉장히 많습니다. 제가 계속 요구받는 것이 헬스케어 액세스 포인트에 방문하는 국민들이 가령 키, 몸무게, 게이트라든지 이런 생활 습관에 관한 데이터를 그 정보화하자. 키 몸무게에 관한 데이터 서비스는 패스트 패션 제조하는데 굉장히 큰 도움이 됩니다. 그래서 제가 말씀드린 것은 정보 각 개인의 의료 정보의 그 개별성을 전혀 침해하지 않는 방법으로 그런 디지털화된 헬스케어 액세스 포인트에서 우리가 발생시킬 수 있는 많은 정보를 가공해서 그것을 기업들한테 이용할 수 있게 해야 선순환돼서 그 기업들이 계속 그 헬스케어 인프라스트럭처를 운영하는 데 드는 비용을 그러니까 적자를 보고 제공하든지 아니면 서비스 비용을 받든지 그렇게 해야만 된다는 그 두 가지 포인트 말씀드립니다.
Thank you very much for sharing your very important view. Actually, I'm going to give the last questions for the third round of the question and answer. Before that, I'm going to invite a burning questions, comments from the audience, if you have. Please, microphone going there.
My name is Dr. Abu Gama, MD, PhD, from North Africa, state of Libya. My question is, I really don't understand the difference between smart city, health city, and smart health city. So I need more practical manner explaining about this. This is the first question. My second question is, if I agree with Professor Hong that the next pandemic is coming soon, as you said, and let's make it more clear, if the COVID-24 is coming very soon, then do you think that this project, either smart city or health city or smart health city, there is enough time to catch up with this? Thank you.
Okay. Great questions. Thank you very much. So quickly, smart health city is not just a combination of smart city and health city. We say the new dimension of city development, focusing on or centering on health and safety of people, not convenience or efficiency oriented society. So for instance, if you imagine smart city, everything is automation and very much efficiency. But my question is, people living in the smart city is happy? Maybe not. So we want to make society with a better life, the happy life, and the good interaction with other people. So that is the smarter city. But we need to utilize smart technology to achieve such a society. So that is a brief my response about the smarter city. Second question, it may take some time, probably long time. But that means actually we need to start now. We start earlier, that's better, right? So that is my quick response. Another quick questions or burning questions from you. Okay, so I will giving the last round of questions only to the other members. You said about the commitment to leadership is very important, right? And we talked about the resources, finance, and some multi-sectoral cooperation, right? So that is really very much important to achieve smarter city in everywhere, particularly in ASEAN. So, but for the political commitment, there should be a talk in the political level, high-level talk, about smarter city, right? So I'm thinking this is just my thought, not representing this forum, just my thought. If we achieve such a high-level political consensus on smarter city, we probably need some kind of invitation of high-level officers. We already have high-level officers now, vice minister, but the really top level, people in the country to say about commitment to achieve next level society. That would be the smartest city. So my question is it a good idea to have such a smarter city summit in this kind of the forum, for instance, next year or whatever? So a little not easy question to you, but from Cambodia.
I think, as far as I understood, and especially in the past few years, I was informed that probably or most of the year, for sure, there will be another forum for next year. When it comes to your question about whether or not there is summit within this forum, whatever, I think it's worthwhile having some kind of a specific summit in terms of talking specifically on this smart city or health city, whatever, as another next step. Because as I mentioned that if we agree that it's a priority, it's a good thing, why not going for it? If we were to go for it, how and from when? So we need to start from some point. And we agree that we should take some action, at least for doing some action, otherwise just talk. So then, if we agree that talking at a higher level, whatever we call summit, super summit or whatever, then it's worthwhile to me. It's a back-to-back with the forum, or even it's a standalone, a separate summit, I don't know, or if it incorporated or embedded with the ASEAN meeting, especially in relation to health, environment, or something. I think it's to my personal view, it's worthwhile going for it.
Okay. Something like ASEAN Smarter City Summit.
Because every year there's ASEAN, there's there's a different forum or meeting within the ASEAN Summit, something like that. I don't know whether it could be brought to the top ASEAN Summit or a technical area, like I could not recall. I had been involved in some of ASEAN, some HD, whatever. But when you look at the possibility of bring it to higher level within ASEAN, or even higher, or even bigger than ASEAN, I don't know. Okay. G20 or G200 or something, I don't know. Thank you.
Okay. So actually, the 2024, next year, the ASEAN chair is Lao PDR. So what do you think?
So thanks again. Further on, I agree with you about the question from the floor. For example, smart city and health city. So for health city, we focus on healthcare. And smart city, I think many sectoral collaboration. For example, Ministry of Finance, Ministry of Transportation, something like that. But for the future, for the health city, so I agree with Dr. Maus again, because we have to prepare that, especially for the next year. We will the chair for the ASEAN summit. So I have to prepare, we have to prepare for everything, especially technology, transportation, environment, and also healthcare. So for the healthcare, so we have a team to serve in the meeting and also not only in Vientiane capital and also in the province that we have a plan to organize the meeting in the provincial. Yeah.
Okay, thank you very much. So Indonesia is currently ASEAN chair. But this could be your personal view. So.
Okay, so Indonesia last year has become the presidency of G20, and we are proposing a pilot project of universal verifier mechanism on the health certificate about COVID, where every system have their own system of technology to verify a certificate of COVID, and why we don't make it universal. And then it was adopted by the WHO just this year. And the second is from the result of the G20, we also have this pandemic fund that can be used by the country that need. And also from the G20, we have the commitments from the presidents and from the G20 country. And it's also the same with the ASEAN. We also propose this ASEAN verifier mechanism and knowledge management center on health. And I also agree to the idea that why don't we make ASEAN summit next year with Lao as the president, and we can make this health city become one of the side events maybe, or one of the commitments that being approved by all the ASEAN's presidents. That I guess the most also highest political commitments that we get, not only from our country but regionally, and maybe in the global context. We can get it from the ASEAN and from the G20 and others forums, international forums. I guess that's from my point of view, that how we make it to the next level to have a better commitment from the higher context. But I guess not only from the presidents, but also from the parliaments. I guess it's also important. I know that there's parliament meetings in the G20, in ASEAN, or maybe in open government partnership, and that we can also propose it for the healthy city, because the parliament is the voice of the people, right? and we are proposing them to voicing how we live in a better city, a healthier city, because we have the right regulation, we have the right tools, we have the right infrastructures that make we as a citizens happier, we as a citizens healthier. Thank you.
Thank you very much. So yes, you point a very important point. We should include parliament too. So there is a ASEAN parliamentary meeting, right? So that is a very important point. So now the time is already the closing. So we had a really good discussion about the vision and concept smarter city and what is required, and what is the way we need to take to achieve the smarter city. And then finally, we come up with some kind of a meeting, very high level, not just administration, but also parliamentary. So I'd like to discuss with you about how to realize such our the consensus, at least in this meeting. So probably next year we will have the much more commitment from the higher level, and so that I hope that should not be the just dream. So we need to realize by co-working. Also the another important consideration is how to engage the international organization, the WHO and GCF or World Bank, ADB. So that is also very important for being partners for the development of smarter city. So thank you very much for your great contribution as a panelist. Also, thank you for attending this the meeting. I'm now closing this session. Thank you again.